Welcome back, everyone. You know, I think a lot of people might be hesitant on a trip to the dentist. All the poking, the spitting, but it's all still important to take care of those teeth. And that's why today we have Dr. Trent Smallwood with the Center for Contemporary Dental Concepts out of Tempe, known for their non-invasive procedures. Thank you for being here this morning, Doc.
Thank you.
You know, we talk about and we tease, especially my husband, I tease him because he hates going to the dentist, but it doesn't have to be painful. Dentistry has actually come a long way over the last 10 years.
It has. I mean, dentistry over the last 10 years, I would say, has made the biggest jump of any generation in dentistry. It used to be, it hurt. It was expensive. Things have changed in every way. I mean, they used to take so much tooth structure away, and to see what's underneath after a filling has been done would scare people, and then the pain to follow. It doesn't need to be that way anymore. Now we take a lot less tooth away, if any, and then the pain is almost non-existent.
Let's talk about some of the most common issues that you treat as we take a look at some of the pictures here. There are a lot of different ways of doing dentistry, as you said. Talk about this first photograph.
True. When you look at this picture on the top, I mean, that just scares people. That's what they think of when they think of dentistry. I mean, that's enough not to...
That's a person's teeth?
It is a person. That is not anything else but a person right there. Now, ironically, to put a restoration or a crown or some sort of filling is what you'd see on the top is typical dentistry that's practiced still today over 95% of the time. The dentistry on the bottom is actually before I'm placing the restoration. So you can see it's the same thing in the sense that I have taken very little tooth away, but I will be placing a restoration on the top of this. So what I'm trying to explain or show here is the fact that it just doesn't have to be as aggressive.
And you don't have to chip away, like you said, at that whole tooth. You still get to keep a lot of your original.
5% versus 85%.
Oh, wow, huge difference.
Big difference.
All right, this is, it looks like you did some shaping here?
It is. Well, actually, this is veneers. Veneers can now be placed without really even touching the teeth underneath, which is wonderful. It used to, like the picture before, we used to have to take 85 to 95% of the tooth away, which was a lot. People think of nubs underneath. Now we're able to just place veneers, as you see on the lower right side here, conservatively in as little as 2 or 3 appointments. And you have a beautiful smile that could last you potentially 15 to 30 years. That
perfect smile. And then our next photograph here, you really see the restoration process. What did you do here?
Well, the upper left again is to show what traditional normal dentistry that we see every day that doesn't have to be that way. The middle picture is where the patient came to me slightly modified, and then I placed veneers on the bottom, as you can see on the lower right side. And so as a result, the patient needed very little anesthesia, no post-operative pain, and within a few weeks had this beautiful smile.
What kind of dental conditions or patients do you see for veneers? You seem to do quite a few of those.
We do. I do. It's one of those things where if you have chipped teeth, you have discolored or broken teeth, rotated teeth, or just generally teeth that potentially aren't there. You lost them over the years in the front or the back. Those can be now recreated in such a way that we've been describing today.
And when you don't address them, it only gets worse over time. We've heard that.
It does.
So that's why coming up on Tuesday, the 26th, you are doing free dental consultations. Even people are afraid to just go get consulted because it usually costs something.
It is. This is for adults only, of course, but it's one of those things where we just want to be able to show the community that you can do this type of dentistry in a conservative way. Does not have to be aggressive. We can show how there's no pain associated with these type of situations and scenarios. And it is exciting because we're excited to be able to educate the public.
All right, we'll put all the information on our website as well. Again, it is Tuesday, though, the 26th. Mark your calendar. Center for Contemporary Dental Concepts. They're right there on Warner near Kyrene. Dr. Smallwood, thank you so much for joining us.
Thank you for having me.
All right, that's why he has such a nice smile.